So, welcome all, and thank you so much for joining us this afternoon for Insurance. Are we all speaking the same language? With Marianne Buehler of the National Home Infusion Association. Open enrollment has begun, and we know there are some specific needs in the nutrition support community. And if you're looking for an insurance plan or trying to navigate insurance, it can often feel like a different language. So she's going to share some basic information about the language of insurance and just some of the things to look for when you are trying to choose a plan and sort of navigate that world. As we go, please feel free to utilize the Q&A feature. And you do have the ability to chat with the hosts and panelists. We're trying to keep side conversations to a minimum. So if you do have any thoughts that you would like to share as we go, feel free to drop them in the chat, and we will try to make sure Marianne addresses them or talk about them a little bit later or on another event. So please don't hesitate to reach out to us. But if you have specific questions about the topic, feel free to use that Q&A feature. It looks like the two little chat bubbles on your bar. And you don't have to worry about video or anything with that. That's just not anything you have to worry about in the webinar format. So that's cool. So all of that being said, if you have any technical difficulties, use that chat feature. Otherwise, Q&A is fine, and we'll keep an eye on that. And without further ado, I will turn it over to Marianne.
Thanks so much, Maisie. Hi, I'm Marianne Buehler, like you said, with the National Home Infusion Association. And I've worked with a few people from Oley, and we decided this might be a great presentation for your group. And hopefully, if you have a lot of questions, please feel free to ask, or if we can't answer them in this session, hopefully we can get back to you with answers and or just help you navigate the world of insurance. Just a little bit of background about myself too. The reason I can hopefully speak on this and answer some of your questions is I have been exposed to insurance all of my life. My family owned and operated an insurance company and agency. I actually sold insurance in California back in the day. And I've been billing and in revenue cycle management for many companies since the 90s. Now I'm dating myself, unfortunately. And then in the last approximately 25 years, I've been in home infusion. And so that's how I met some of the people there at Oley, and that's how this got started. So hopefully this will help answer some of your questions. It won't be completely specific because I have to stay away from directing you towards an insurance company, but I can definitely answer to the best of my knowledge. Okay, now one second. There we go, slides. All right, so today's objectives are hopefully to understand and learn some of the terms used by insurance companies, because I think a lot of times if you can speak the same language that the insurance company is, then you can go ahead and understand each other, maybe get a little further if you're having problems, and that they can direct you to the right people within their organization. I want to help you identify some of your benefits. We'll talk about Medicare, Medicaid, government practices, some commercial insurances, so that you can determine which benefits will work best for you and your loved ones. And then hopefully we'll gain some understanding and insight into some of the questions to ask your providers and your insurance companies to get the most out of your coverage. When we look at things from a reimbursement perspective, so for me at NHIA, we normally look at two types of insurance, really. There's commercial and there's government. So those commercial payers are names you're probably used to, like United Healthcare, or what we call UHC. You have Blue Cross Blue Shield that has a commercial payer, and they can each have their own state, such as like Blue Cross Blue Shield of Kansas, Blue Cross Blue Shield of Nebraska. Then there's Aetna, just to name a few. And each of those commercial insurances also have what we call a PBM, or their drug program. So Pharmacy Benefit Manager, their drug program. So like United has Optum, Aetna has CVS. So if you have Aetna insurance, you get your drugs normally through the CVS program. And then there's government insurance. And when we speak about government insurance, we're mostly talking about Medicare. So there's 4 different parts of Medicare: A, B, C, D. And then there's railroad Medicare if you're a retired railroad or person. With Medicaid, there's 50 states. And even if you want to include Puerto Rico and Guam in the United States, then there's also 52 versions. So every Medicaid it's federally funded, but it also has state funding. And so each Medicaid is run by its state. There's TRICARE, which is your active and retired military. And the last one is the Indian Health Services, which I'm really not going to speak much about today, but I didn't want to leave anything off when I was discussing the different types of insurance. So a little bit about Medicare coverage. Let's talk about the different parts of Medicare. Each one, you have Medicare and you have what it covers and if there's a premium or not involved. So Medicare Part A is normally what people think of when they think of hospital insurance. So this, if you go into the hospital and you have Medicare coverage, you're going to be covered under your Medicare Part A. And it includes also skilled nursing facilities, some hospice, and some home health care. Usually, if you are getting Medicare, you do not have to pay an additional premium for your Medicare Part A. It's part of your, it's just part of your senior and over 65 when you become eligible, if that's the way that you become eligible. And we'll talk a little bit about Medicare eligibility in just a second. Then you have Medicare Part B. And most people think of this as your medical insurance. So your physician's office, your outpatient care, your medical supplies for durable medical equipment. And most people do pay a premium for this every month. There are exceptions. I'm just talking generally. And then you have Part C, which are your Medicare Advantage questions. So all Medicare Part A and Part B benefits, and most have Part D coverage too. So it has to cover at least what Medicare Part B and Medicare Part B cover. But then there's also additional coverage such as vision, hearing, and dental. I see that there's a question, and I'm going to come back to that in just a little bit to hopefully what I'm going to talk about will explain it. And then you have Medicare Part D, your drug coverage. So this is going to be your generic and brand name drugs. And the premium can be included in your Medicare Part C if you have a Medicare Advantage plan, or it's going to be in addition to your Medicare Part B. And all of those have different premiums depending on the type of coverage that you select. So who's eligible for Medicare? And let's take a little bit about this. So if you're a U.S. citizen or a permanent legal resident for at least 5 continuous years, and you are 65 years of age or older, you have a qualifying disability, so you could be under 65 and have Medicare. Again, the question, somebody on Medicare, but if you're under 65, you probably have a qualifying disability. And lastly, you could have end-stage renal disease or a permanent kidney failure requiring dialysis. Or you also have ALS, Lou Gehrig's disease. So these are all what the main eligibility is for Medicare. So when you talk about a qualifying disability, that's also what we call an SSI. So Social Security and qualifying for Medicare that way. Some of the terms that you need to know going into Medicare are open enrollment, which I think Maisie stated as we started this conversation today. Open enrollment for Medicare is between October 15th and December 7th. You want to know the difference between the plans. So we talked about Medicare A, B, Medicare D. I think it's always good to know that there's also another term for that Medicare Part C, and those are the Medicare Advantage plans. And I think if you're anywhere in the United States right now, you will see an ad for this on television, just about any time, at least on most of the TV channels my husband and I watch. The other part of Medicare, so those are all the different parts of Medicare, but you can also have a Medicare supplement. And what that is let's say that I am 65. Let's say that I have Medicare, what we call fee-for-service, so straight Medicare. I can also have a supplement. And that's also called normally like Medicare Gap or Medigap insurance. So when I have Medicare, I normally go to the doctor, and those doctor services, it'll cost, say the cost is $100. Medicare will pay 80% of that, and then I'm on the hook for, or I have to pay 20% of that. If I have a Medicare supplement, normally that Medicare supplement is going to pick up that 20%, when even a lot of times your deductibles, and you could even have additional drug coverage. There's also Medicare secondary, or what we call Medicare as a secondary payer. And when this happens, you can be lucky like my husband, and so he's over 65 and I'm still working. So as his wife, I have employee insurance, and so then he's covered under my employee insurance, and then Medicare covers secondary. So we do this because there are some gaps in coverage with Medicare, and so I like that he has my commercial insurance and then Medicare as a secondary payer. And I put in this catastrophic coverage about Medicare because in 2024, if you have a Medicare Part D plan, catastrophic coverage is going to change a little bit. So this is part of your Medicare Part D, and there'll be some changes. When you're out of pocket and manufacturer subsidized costs equal $8,000, then you'll no longer be subject to that 5% catastrophic copay. So what a lot of studies are saying is that this means that your total projected costs, out-of-pocket drug costs for Medicare Part D will be about $3,300 in 2024. I think it was closer to like $3,600 this year. I also wanted to just touch base, since this is for Oley, is that Medicare coverage and how it covers enteral and parenteral nutrition. To me, it's interesting, but the Medicare enteral and parenteral coverage is under the durable medical equipment policy. So what happens with that is that when you're under durable medical equipment, what happens is it has to withstand repeated use, because this is the definition of it. It has an expected life of at least 3 years. So that's that piece of equipment. Normally, let's say a pump. A pump can withstand with repeated use. It has an expected life of at least 3 years. It's primarily and customarily used to serve a medical purpose. It's generally is not useful to an individual in the absence of an illness or injury, and it's appropriate for use in the home. So normally, when you're talking about enteral or parenteral nutrition, what happens with Medicare is it's replacing that body part that's no longer functioning or that doesn't function, say, for at least 90 days. So that's where that is covered. As you look through Medicare coverage over the next few weeks, through your open enrollment, there are some sample steps to take for Medicare coverage. You want to prepare for enrollment. Make sure that you have everything that you need. You want to review the costs and coverage. So there's many plans out there. You can take a look at that. If you're not sure, you can always ask, but you can go on the Medicare website and take a look at what can be done. Understand where you're going to have some coverage gaps. I've been talking to a few people, and sometimes when your child's on parenteral or enteral nutrition, if they're on a TPN, they can't give coverage for enteral. So you can only have one, in a sense, way of getting food to you. You can't do both. And so that's an issue that some people have when on this coverage. So there are some coverage gaps, and you need to know where they are so that you can determine how you're going to pay for things. I do, hi Sherry, I do see the questions. I was just going to answer it at the end. Because they're coming by so fast and I can't double read. So I'll just wait till the end and then go through them if that's okay with everybody. I want you to explore some of the Medicare Advantage plans. Sometimes they have better coverage for you than what we call the regular fee for service, so the regular Medicare. Evaluate your options and then try and make that educated decision. And I do have these steps that I got were just from Humana, and just to direct you to where you can go for some additional information. Medicaid coverage. So Medicaid coverage is a little different than Medicare in that Medicare is the government, but it's the federal government, and it overreaches to all 50 states. There might be a little bit a difference state by state. It's pretty tiny because they have Medicare has guidelines that they have to follow, but sometimes because they have different fiscal intermediaries that you submit your claims to, which is all important, that they might have a little bit different coverage. But when we come to Medicaid, it's 50 different states, and what's covered in one state might not be covered in the next adjoining state. So just know that that happens. Medicaid coverage, you can, is a public health program for low income families with children, seniors, persons with disabilities, foster care, pregnancies, and it can sometimes be disease-based. Most of the time, in order to get Medicaid, you're going to have a modified adjusted gross income. That's how they determine who's going to get coverage. And then there are services that are exempt, or people that are exempt from that, what we call the MAGI, so the modified adjusted gross income. So if someone is blind or disabled, they're age 65 and have SSI. If they're adopted, if they're part of the adopted assistance agreements, or the child's been in former foster care, then they would be able to continue with Medicaid coverage. With Medicaid, there are benefits that are covered too, and they're usually called usual essential health benefits. And this is just one state, so I picked California, that gave information about how they cover for Medicaid. So they'll cover outpatient, emergency, hospital, prescription drugs, dental. And like I say, a lot of times, state to state can be different, but a lot of times whatever Medicare covers, Medicaid will too. And then Medicaid actually has additional benefits that Medicare doesn't. It depending on the state or how you qualify for that Medicaid. The steps for enrolling in coverage, and this I do want to step back just a second and say you want to enroll in a plan. We call it fee for service, which is your regular Medicaid. A lot of times your first 45 to 60 days, you're going to be in that fee for service program, and then you can enroll in the managed care programs. But if you are on Medicaid this year, please be careful, and please look in your mail, or if you have a login to your state Medicaid, please go in there and remember to renew this year. Many programs, it's a federal mandate since COVID. There were many people that were enrolled in Medicaid that are now being what they call disenrolled because they don't meet the coverage criteria anymore. So Medicaid is disenrolling them. And so everybody out there that has Medicaid is being validated, and you should receive something to revalidate your enrollment. If you don't go out to, if you don't receive it, please go out to their website and make sure that you get it, and make sure that you revalidate. So some insurance terms. So what to know insurance terms. Deductible. And I am a cat lover, just so you know, an animal lover. So this little graphic just kind of cracks me up that when you go to get insurance, it's like, okay, this is covered, but this isn't. And so cats are known to have 9 lives, and so it only is going to cover your odd number lives. And so some of the insurance terms that you should know about are deductibles. Every insurance out there has a deductible, sometimes based on your need. You might not have to pay for that deductible. You might qualify for services that don't require you to pay that. But it is good to know if you have insurance out there, and especially if it's commercial, you'll have in-network benefits and out-of-network benefits. And those benefits can be very different, and each can carry their own deductible. So let's say, for an example, you have a $1,500 deductible if you're in network. You may have a $3,000 deductible if you go out of network. And that can be, very important. Sometimes you don't always know, or let's say that you're in a different state and you get into an accident. You might not be in network with that other hospital. So those are when those deductibles really come into play. The other insurance terms to know are like preventative care. This is really important to know because a lot of times preventative care was going to be covered at 100%, where the next level of care is probably treatment and diagnosis care. And that coverage is normally not at 100% with every plan. That might be where the insurance pays 80 and you pay 20. So know that those are going to be out there. There's urgent care, where, you go into the emergency room. There might be additional deductibles that you have to pay. There's out of pocket. Out of pocket is important because you may have a deductible, say it's $1,500, but you also have a plan that says you have a $5,000 out of pocket. So what happens there is you're going to pay everything up to that $1,500. And then when you hit $1,500, your insurance is going to pay 80 and you're going to pay 20 up until the time that you reach $5,000. So, and I'm just using numbers just to give an example. It could be less. A lot of plans are less, some are more. But when we talk about other plans, especially if you have employer plans and you have like high deductible health plans, those are good to know about, because sometimes then you can do different types of health savings accounts where it can go and help you pay for those services, and or a flexible spending account. And that's the type, these are both employer based, but where if you have a flexible spending account, you normally have to spend all of that by the end of the year, and a health savings account can carry over from year to year. There are additional terms just to know with health insurance. And the reason I go over these a little bit more is just because when you call an insurance company, and I look at maybe some of the populations or your loved ones, it's not that you don't have coverage. It may be that you're getting denials or they're rejecting something for one reason or another. And so if you know these terms, you're able to more easily speak with the insurance company. So additional terms to know are coverage criteria. So what's going to be covered? You're going to ask your insurance company that. You're going to ask the provider that. What is the coverage criteria? I will tell you too, a lot of times if you're on a particular drug, you can search the web and see, is there a prior authorization or a form out there that tells me what's the coverage criteria, either for my insurance or for others, so that you can know what that is and you can help meet that coverage. A claim, the word's pretty self-explanatory, but that's where your providers live. with the insurance company and those payers is the word claim. Every time they send in information about you, it's on a claim. And so you just want to know and be familiar with that. I'll show you what one looks like in a minute. You want to know about exclusions, or is something excluded? So what won't your insurance company pay for? Take a look at that, especially over these next few weeks as there's open enrollment, or if you're on a Medicaid plan, it will tell you what is excluded. Go out to your state and take a look. Know that you are the beneficiary, or your child is. You might be a subscriber, the child's your beneficiary. They're the person that's covered under the plan. Insurance companies and your providers also live in this world called explanation of benefits. What that is you send in a claim. This is the information that they get back and tells you what's covered and what's not. And what you get at home or on a website is very different than what your insurance company, what your provider gets. So sometimes they're talking, well, it's on your explanation of benefits. Ask them for a copy of it. This can help you understand what they build, how they build, and what's not covered and what is, because what you see might just be words on a page. They don't send you the codes that the provider billed with. So this can be very, very helpful. The remittance is very similar to the explanation of benefits, and a lot of times, a lot of people will use these terms interchangeably, but the remittance tells them how this check is being paid, or how this money is coming to the provider. We talked a little bit when we talked about Part D as PBM, your pharmacy benefit manager, and then medical claims. Those are important to know. And I put this pharmacy benefit manager, medical claim, and pharmacy claim all on here because a lot of times when you go to a payer, especially like a home infusion provider, they have, based on their contract, they can decide to send your claim through your medical insurance, send your claim through your pharmacy. So that happens a lot of times. And they look at that and they say, which is better for them as a company and which is better for you. So sometimes if something's not covered, ask them, can you bill this through the pharmacy, especially if it's any type of drug or any type of your enteral. Sometimes it's going to be covered medically. Sometimes it could be covered through the pharmacy. So ask them. And it can also make a huge difference in what your copay amount is. So make sure that, because if you have a pharmacy claim, normally there's always a copay associated with it. If you have a medical claim, once you reach your deductible and you're out of pocket, you no longer have to pay. But under a pharmacy, you might always have to pay a copay. So it's very important to know how something is covered. And then lastly on this page is your payer of last resort. And I put this here because it's very important to know that Medicaid is a payer of last resort. So if you have Medicaid and you have Medicare, hopefully when your provider goes to bill, they're going to bill Medicare first and then Medicaid. Sometimes based on names or things along those lines, that your provider might get those mixed up. And when that happens, your claims deny. So you want to make sure that they always list your Medicaid plan last because they're a payer of last resort. I'm going to speed up a little bit so I can get to your questions, because I see that there's some great questions up there. So one of the other big things that happens a lot with your type of coverage for you and your loved ones are requiring prior authorizations. And it's just good to know, and I put it here because this can really be a stumbling block. It can take some time for this to be covered. It's based on the payer, and you can get a prior authorization almost immediately, normally 24 hours, but they're allowed to take up to 2 weeks, and that can really make things just take a little bit longer than you like them to. But if you're if you or your loved one are coming out of the hospital, this is where that authorization can really, take a lot of time, and it can really take a lot of time for either you getting the coverage and getting out of the hospital, or getting out of the hospital and waiting for a particular drug or service. So just be aware of it. There's not always things that you can do to speed it up, but a lot of times when I'm a provider, I'm limited to what the insurance says. If they say it takes 24 hours, it takes 24 hours. It takes 72 hours. It takes 2 weeks. But sometimes as the patient or as a caregiver, I can call the insurance, and just my call makes it go faster. Sometimes it doesn't, but it's always something to think about, because timelines are always being updated, and there are some new rules coming out about how long a prior authorization should take. I want you to learn some of the terms used by providers. So I said this is the claim form that your provider sends in. They'll talk about a HCPCS code, which is just the 5-digit code that they use to bill. They'll talk about an NDC, which is a drug code. So if they're billing your drug through the pharmacy, they bill it with an NDC. If you look at your prescriptions, you'll see an NDC code on it. And these are just words that they use to communicate with the insurance. So it's always good to know. Or they might use a CPT code, which is very similar to your HCPCS code, but they're just different code sets used by your provider to get their claims or your services to the insurance company and get it paid. And lastly, diagnosis code. So that's a code describing the illness, and it can also sometimes describe a procedure, but it's very important for you to know. And the reason I say that about the diagnosis codes is because this is when you can get into some of the questions that you can ask your provider. So you always want to ask your provider or even the insurance, how is something covered? Is this, or how is this service covered? So whether it's enteral, parenteral, any type of service, ask how it's covered. And if you're talking to your provider, ask for a sample claim. What are you going to send to the payer? What codes are going to be there? Because that way you can then match things up, or even if you need to get a service covered and you're calling the insurance company, you can ask, hey, is this service covered? Or what service is covered? This is the code that the provider gave me. And that can be really helpful. And I always want you to know your diagnosis codes, especially if you're being a caretaker. So I had to be a caretaker for my husband in this last year, as he had to have a couple of surgeries. And it was always really important to me, what is the code that you're doing this surgery for? Why? And I want to know not just the name, because they were saying, oh, it's he had back surgery. And I'm like, what's the code number? Because that helps you to look things up, especially on your payer websites. You can know certain codes are covered, because a lot of times we'll say, we won't, like if you have diabetes, so, or you're pre-diabetic, they'll say, oh, you have diabetes, but what kind of diabetes? Because some things are covered under certain diabetic codes and some things are not covered. So it's just important to know. And you always want to know with your insurance, under which benefit is the service covered? Like I talked about a little bit earlier, a medical claim versus a pharmacy claim. This can really make a difference as to how much your copay is, or how your services are being covered. A lot of times, if the primary claim, or if you have two insurances and the primary claim goes to the medical benefit, they can't bill it to the pharmacy later. Or if it went through the pharmacy first, they can't bill it to the medical claim later. This happens a lot with Medicaids. So with Medicaids, if the first claim that my infusion company bills is under their pharmacy claim, Normally they can't convert that claim to a medical claim to get it covered by Medicaid secondary under the medical. So it really is important to know how something is covered. And then always ask, does it require prior authorization? Because if it does, it's going to make things take a lot longer to process. Are there gaps in coverage or denials? If you have any of these, are there ways to fight for coverage? And yes, there is. I always suggest writing an email to somebody, find a name, find your insurance contact information. There's patient advocates out there. Do three-way calls with your payer and your provider if you get a denial. Say, I want to understand why this was denied. And a lot of times, if you get the provider on the phone, the payer on the phone, and yourself, the payer and the provider are going to resolve that on your call and normally get things paid. I've worked with on the provider side where things were 100% not covered. But when I called and said, hey, we're the only ones that can provide this to him, or he can't get this service from another provider right now for whatever reason, then the payer said, okay, we'll pay for it. Because they didn't have another way of getting coverage for a patient. So there are a lot of times, if you get those three-way calls, they can really make a huge difference in what's being covered if you're having problems. Always ask the payer, always ask the provider, what do I need to do? Where do I need to go? And there are a lot of payer websites. I always say, look at the member resources, but sometimes look at the payer resources too, because that's going to tell you how things are covered. And you don't need to be an insurance expert. What you need to be is an expert sometimes in what is going on with your loved one or yourself. And if that diagnosis code, you can Google that diagnosis code on that payer website and see how something's covered. And look at the administrative guides. They really give you an explanation of how something is covered. Again, other questions to ask. You can ask as we go into open enrollment, if there are things that aren't covered right now that you need, ask your current provider. If you had a child or you were in this situation, what insurance out there right now covers this best? Especially, they'll tell you for a Medicaid, which plan might cover the services better than the other. Again, they can't give you advice. They can just say, oh, this managed Medicaid covers this, whereas this one doesn't. They can give you that kind of information along those lines. Commercials, they don't always know the best because you're kind of limited under your employer. But the Medicares and the Medicaids, they can tell you the managed Medicares and Medicaids and which covers it best. And your provider normally is going to know this because they're a specialist in this. So always ask, I have this coverage with this payer. Is there a payer that covers my services better? If you need financial help with any of this, for commercial plans, you can go, there's a lot of copay assistance out there. I put copay accumulators as a financial help, but it goes along with copay assistance. I shouldn't have probably put that there. But there's also alternate funding programs that can help. And if you're on a government plan, you can't use copay assistance, but you can use grants. And again, this is something that you might talk to your provider with. If they don't know, they should know, or they can direct you to other people that know, because they want to try and help you get your services covered too. Every provider really does. They'd rather try and help you get the services covered so that they can get paid. So they know when the grants come out and what diagnosis codes they need. And that's why I say those diagnosis codes are so important, because it can determine what type of grant that you can get. So make sure that you're working with your provider, your payer, your physician to make sure that you are diagnosed or have the right diagnosis. And then just to name a few other places you can go to ask. So Oley, I know, has a lot of help that you can ask. There's Cover My Meds. So if you have a medication that's not covered, there's the PAN Foundation, which is Patient Access Network. which is a foundation which can help you find ways to get certain medications covered. And then search your organizations that support your disease. So if there's a particular diagnosis, again, that you have or disease state, go to that and look up that information.
And I just want to clarify really quickly, we don't have any financial assistance programs. We do have our EDP specifically for enteral donations and to receive those, but we can definitely help find resources for you, but we don't provide any financial assistance. So I just wanted to provide some clarity on that.
Thank you, Maisie. That's what I meant to say. So I really appreciate that. The Cover My Meds will help you find other ways to do it, and same with the PAM, but I thought that Oley can help you direct you to other resources if needed.
Absolutely. Thank you.
Mm-hmm. And then to those questions. So I'm going to scroll up a little bit on these questions, you guys. And just my computer wants to give me a hard time. So
we dropped them all in that Q&A area.
You did? Okay.
You don't have to scroll all the way through.
Oh, thank you. Okay. Can an individual choose if they are Medicaid qualified beneficiary? I don't believe so, but I could check into that. But I think that's how it is. You're a qualified Medicare beneficiary. So also versus QVM, only when they have a Medicaid plan secondary to Medicare. All right. So can an individual choose? I don't think that they can, but you know what, Lisa, let me validate and get back with you on that, if you don't mind. Can you send Maisie, can she send you an email? So
Lisa is another one of our staff members, so she was asking the questions. But I will definitely take down folks' information and connect you to follow up.
Because I don't know when it's a qualified Medicaid or qualified Medicare beneficiary that you can choose much of that.
Okay, I'll scroll back up and I'll grab their information.
Okay. I think you can, but I don't want to lead you astray. So how should we handle insurance dictating what supplies we're able to receive? Well, that's a really good question. What I would say is to work with the insurance and to work with the, if you have a nurse or a doctor that you're working with certain supplies. I know I've worked with patients that, we need, certain supplies. And unfortunately, they aren't covered by your insurance. There could be something a little easier to use and you have to choose something that's a little bit more difficult because that is what your insurance covers. The thing that I would do is I'm a big person when it comes to insurance is to always say, write a letter, and not only write a letter or information to your payer, but if it's Medicaid, write it to your state congressman, saying, why can't we get these covered? Or, and know the reason why you want it covered. It can't just be because it can't just be because it's easier. It has to have either a medical benefit. So if your doctor prescribes one thing and you're getting something else, then say, I can't do it because that's not what my insurance covered, but why do you think this is better for us? And then include that in the letter writing. We have noticed that, it doesn't, you think it takes a lot of people making a statement for something to change. But normally when it comes to healthcare, it doesn't take hundreds of people writing things. It just takes a few people writing some letters to change things. And we've seen some changes happen just by a few people. Or the other thing that I can say is go ahead and work with an organization such as the National Home Infusion Association or other associations to say this should be the standard because, and then help them, bring that up to Medicare, Medicaid, and the commercial insurances. How do we advocate for change or appeals or issues with Medicare? I think I just kind of led into that. That is very similar. And the reason I say write letters, or the other day I was on, I was flying back from DC after a meeting, and all of our congressmen from Nebraska, that's where I'm at, were on the plane. And I was like ready to sit between all of them to tell them what they needed to change. So just go ahead and write them letters. I can tell you that our congressmen here in Nebraska respond to that. You are a constituent and they need to keep you happy. So they try and answer those. Hopefully that's helpful. How do you get an EOB, an explanation of benefits, or any sense of what Medicare is paying per medical claim? What you can do, you do get your Medicare information every quarter, but you can also ask your provider for that. Say, can you send me a copy of the Medicare explanation of benefits so you can know what they're getting paid for? Also, you can just ask the codes too. So when I talked about those HCPCS codes earlier, Medicare has a public fee schedule. It'll tell you exactly what they're going to pay for every service. And it's the Medicare fee schedule is available to everyone. I can always get you a link to it, but you can really just Google Medicare fee schedule or Medicare fee for service fee schedule, and you should be able to get that. Now, what you need is normally that HCPCS code that the provider is sending. And that way you can know exactly what they are getting paid for and how much on Medicare. Just to let you know, there are a lot of rules when it comes to home infusion about what we can bill and when we can bill and how many we can bill, but at least you can get an idea of what they're getting paid. Will a DME provide a sample? Will provide a sample claim they send to Medicare? Well, they should. If they don't, I would question why. Why won't you give me that? But especially if they've already billed it previously, say, I would like a copy of the claim you sent to Medicare. So they should be able to give you that information so that you can take a look at that and know exactly what they sent and the diagnosis codes that they're billing under and the information. There is no reason that any provider should not give that to you. It is your right to have that. And if they're saying they can't or they won't, then you can again complain to Medicare about that. And you can always go to your state insurance company, or you can complain directly to Medicare, but they should give you that. There's no reason for them not to. All right, I've had issues where a doctor or issue is covering during open enrollment time, but in January, that's changed. How do we best find out what will be covered in the upcoming year? Is there certain terminology we need to be using? Well, that's a very good question. All the Medicare Advantage plans and everyone can only tell you what the coverage is today. Because a lot of times, especially with Medicare and Medicaid, they don't release some of their coverage guidelines until the first of the year. Or I can tell you from a provider standpoint, sometimes they retroactive it. Like there might be a new policy coming out. I think like one of the big ones this year is for immunoglobulin, or what we call IVIG. Medicare is not even having a discussion about it until December 15th. So it is difficult for providers to know what's going to be covered come January 1st when they're not only getting notice about it come December 15th. So it is a challenge. The only thing you can do is make the best guess that you have today and go with that. I'm sorry if that's the only answer I have. But it is difficult, and it happens to just about everyone with every insurance. All right, what about when a prescriber recommends something, insurance says they will not cover, but home infusion company says, oh, they will cover, but home infusion company says no. All right. So what happens, I would work with the home infusion company, but so home infusion companies also, just like every provider out there, has what they call a formulary or certain things that they keep on their shelves. So if it's something, where for example, let's say they have to buy 100 of them and you're one patient and you'll only use 2 a year, they're not going to want to do that. You can look at getting a different provider, or work with that provider, say, hey, I know my insurance, I talked to them, they said that we cover it. Here's either an email or a written letter that states that they will, and I'd like to get it. And if you can't get it, can you help direct me to somebody that can? And normally when you say those words, they're gonna try and see if they can get it. But they do, like I say, all have formularies, because they do the benefit, especially for enteral and TPN. What they call the margins is becoming smaller and smaller all the time. And so with that becoming smaller, they can't keep every supply on the shelf. But as a beneficiary, you're allowed to get what you asked for too, especially if your insurance will cover it. So the only thing that you can do is ask them to do it. If they don't, then look at other infusion companies. Are you aware of groups that write up standard language or form letters we could use or tweak for submitting to our state representatives? Yes. Well, there are some out there. I would go ahead and definitely search for them. But if you're having the problem, I would always say, usually if you're having a problem with an insurance company or something getting paid for, other people are too. And you can Google that and see if they have anything out there. I know my brother has Parkinson's. And so when there's something that I want to look at, or I want to run up a flagpole for a congressman, I'll see if the Parkinson's website has any form letters, or maybe you start the letter and hope that somebody else can help write it. I know that working with other people in the organization that might be able to help you write a letter or compose a letter that would help to send to your state representatives, that would be good. I know at NHIA, when we have letter writing campaigns to our congressmen, whether they're state or our federal congressmen, I don't know why that sounds funny. I want to say, you have your state representatives and then you have your congressmen. But we normally go ahead and provide a link, so that is all you have to do is click on it, and it's going to create that template for you and hopefully send the rest. So I know that a lot of organizations do that, so it's just looking for the right one. All right. What are considerations for choosing Medicare Advantage plans for nutrition support patients? Is it always better to have a MAP plan if the patient can afford it? I cannot say one way or the other. I don't know that it's always best to have a Medicare Advantage plan over the Medicare fee for service. The Medicare Advantage plan is supposed to cover everything that the Medicare A and B covers, and usually your Part D plan. But sometimes it's easier to, if you're having any issues, to work directly with Medicare than it is to work with, say, the third-party administrator, which is like Humana or whoever might be managing that MAP plan. That being said, I think there's a lot of affordability to MAP plans, and that MAP plans offer additional benefits that you don't get with the regular fee for service. So it really just depends on, are your regular services covered, and do you want those additional services that would be covered through the MAP plan? And if so, then it might be better to get. Yeah, there are so many items or formula out there for enteral nutrition that it would be impossible to keep them all on the shelves at the same time. It really is. And, you know, I was talking to an enteral provider just yesterday, I think it was on a call, and, you know, they switched from one formula to another. And I'm like, oh my gosh. So, you know, they went from, say, Abbott to Nestle. And I said, so what happened with some of your patients? And they're just like, you know, some of them didn't want to change. And when they didn't want to change, they went to another provider because, you know, we had to do, you know, Nestle because that's, you know, that's the only way that we can afford to be in the enteral business. And so it's difficult. And so they lost quite a few patients that didn't want that particular formula. But I understand that if you've been on a formula for a long time, you don't want to change your loved one or your child or yourself from one to another, because you know how you react to a certain one. So it's very important, I think. You might have to look for other providers when that happens. Maisie, so is that it for questions too?
I think so. A couple of resources were shared in the chat. So hopefully everybody can see those if I did it right. And I grabbed that person's information. So I think if nobody else has any last minute questions, we are good.
Well, yay.
Thank you so much. That was very informative. I am a consumer myself and spend a decent percentage of my life fighting with insurance. So having some of those tools in my toolkit will be very helpful.
Well, thank you. And I hope that, you know, if you guys do have questions, reach out to Maisie, and Maisie can get them to me and I'll answer them the best that I can. So I really appreciate all of you, and thanks for joining.